guys, welcome to another episode of the Friday Floating. I'm going to wait for Sarah J. Murphy to come online, but today we're going to be talking about nutrition and activity, specifically for those who are pregnant or who are trying to conceive as well. So it's going to be a great talk. Sarah did this for us when we were organising Saturday Strong, so it's going to be great. She has just joined, but yeah, it was a lovely, nice talk about that. So perfect. Well, hello. Hopefully she is coming in now. Yes. Hi.
Hiya, how are you?
I'm good. How are you, Sarah?
Good.
Fab. Happy Friday. I feel like this week just flew.
Yeah, darn it.
Perfect. Thanks so much for coming on. I really appreciate it.
I'm delighted.
Yeah, it's good. I was just saying there, kind of as your intro, that you were doing this talk for myself and Aoife when we were organising Saturday Strong, which is for Women's Aid. So it was great. I actually watched it myself. So yeah, lots of good info in it. So pretty much we'll be kind of covering all of that for those who maybe missed that one. Perfect. So I guess do you want to introduce yourself? Do you want to talk a little bit about kind of what you do for your day-to-day job, and then we'll kind of crack on with the questions.
Hi everyone, my name is Sarah. I am an obstetric and gynae doctor, and I'm working in the National Maternity Hospital in Dublin at the moment. And sort of, I suppose our day-to-day job involves, it's different every day. We can be working in antenatal clinic, and that's where you're seeing women who are in their pregnancy, you're delivering babies, you're seeing women after they've delivered, or you're seeing women with a whole host of problems to do with their menstrual cycle. And I suppose part of it, and what I think we're doing a lot more now, and it's something I have quite a special interest in, is kind of the lifestyle and the more holistic approach to health, especially in pregnancy. And that would include things like your diet and exercise, and what their role in pregnancy and conceiving, and the safety of both as well. So that's kind of where I'm going with this.
Yeah, brilliant. And I know when you were doing the talk as well, that kind of a lot of what you were talking about was not only what you can do during pregnancy, but what you can do before pregnancy as well, specifically when it comes to kind of nutrition and activity. So if we're kind of thinking, I guess, that pre-pregnancy, or what I think is actually called the prenatal stage, that kind of, when you're trying to conceive, for you, what would be the kind of, I guess, most common things, or what would be your kind of big rocks with regards to recommendations for people who are in that stage and are kind of considering maybe they want to have kids in the next while, and what steps that they can take to kind of support that?
Yeah, so I suppose there's two, we'll say, just big general steps that everyone can take. I suppose when you are thinking about a pregnancy, you would like to be in the best health possible. Pregnancy, while natural and something that obviously someone is doing every day, is a massive stress on the body. And if you can go into that in your best possible state, it will stand to you, and it will stand to how your baby will do. And the biggest one is weight. And I know that can be a kind of touchy subject with some people, but it is. We know that either women who are underweight or overweight, one have higher rates of infertility or issues conceiving, and the second is we know that both are linked to problems in pregnancy. So if there is room to explore either losing or gaining weight, that's something you should definitely consider, and that might be something you can do alone or with the support of your friends, or it might be something that you need the support of a GP or a dietitian or a personal trainer, and that's just something to think about. Then the biggest one that we all talk about is folic acid.
Yes.
Folic acid is a type of B vitamin, and it is really important for babies, for their spine and their brain to develop. And I think it's kind of the unfortunate thing with a baby's brain and spine developing is it usually happens over the first 6 to 9 weeks of the baby being conceived. And often people don't know they're pregnant until 6 weeks, unless they're, really on top of their cycle. And, so often by the time you find out you're pregnant, it's too late to be taking folic acid. So, we would argue that every woman of childbearing age who's sexually active should be taking folic acid. But certainly if pregnancy is something you're thinking about, you absolutely should be taking it. So they're kind of my two biggest ones. And then obviously there's more, vitamin D and iodine and calcium. But there, I think if you really want to just get down to the really important and basic things, I would focus on getting to a healthy weight, or getting into a healthier lifestyle, even if your weight doesn't change, but you're moving more and eating more variety and folic acid.
Yeah, absolutely. And like, we've seen a lot in the news as well, people talking about how they've lost their cycle through overexercising. And again, I know that kind of it's probably the most common you've spoken about within the realms of, I guess, kind of elite athletes and everything, but it's definitely something that happens to, I guess, quote unquote normal women, so people who aren't necessarily competing at an elite level but take their training really seriously or just really enjoy it and kind of do it a lot. And it's not to say that you can't exercise, but it's just sometimes, bringing a little bit of awareness of, I guess, menstrual cycle awareness and being like, okay, well, actually, has my cycle gone weird, or am I actually having a regular cycle? And, do I know if I'm ovulating and stuff like that? Because it can it can be hard to make those adjustments, and especially maybe within I guess a short time frame. If you all of a sudden are okay, let's try and have a baby. I think people kind of forget that we spend so much of our life trying to avoid getting pregnant, and then all of a sudden we're like, right, I want to try and have a baby. But there's so many of those steps that you kind of have to go through, as you said, to make sure that you're kind of in the best possible place to get pregnant, and then to kind of support that pregnancy as well. I think, wasn't it I've forgotten the name of it. I know Aoife went to it, and you mentioned it in your talk as well, where it's like what you do now during your pregnancy or when you're trying to conceive actually continues through for that whole life cycle. Which, do you
Exactly.
want to talk a little bit more about that? Because I think that's fascinating.
I think it's fascinating as well.
Yeah.
It's we're now seeing it more and more, and there's a lot of work and studies going into this, and it's your health during your pregnancy will affect two things. So one is that we're seeing is it'll impact your child's health as they go forward into childhood and adulthood. So if we'll say women who have gestational diabetes or women who have obesity in pregnancy, their children are more likely to have childhood obesity and then progress into adulthood obesity, which then is associated with things like obesity and heart disease. And then women who have, for example, gestational diabetes are more likely to have type 2 diabetes. The newer one we're seeing is women who have a thing called preeclampsia, or some people might register it as toxemia. They're going forward in life to have problems with their kidneys or strokes. Not all of them now, just it's an increased risk. So we're really seeing that how your body is supported in a pregnancy and how it responds to that pregnancy is kind of a predictor of what your health will be like in later life. So it's really one to pay attention to and protect.
Yeah, I think that's so important to know, because like I wouldn't have known that, and this is an area that I work in. Do you know what I mean? So like it's so important not only for me to know, to be able to pass on to my clients, but just for women who are either getting pregnant or trying to get pregnant, to kind of, as you kind of said, that whole holistic approach to their overall health, and that there is so much that you can do. And it's not to put fear into people, because you don't want to fear people. It's just to kind of educate about I guess the importance of trying to be as healthy or as balanced in that approach as possible. So I think that's really fascinating,
Yeah, no,
especially like for the child's future health as well, which is kind of a hard one to get your head around, but it's quite convincing when you look into it.
yeah.
So
And I
yeah.
suppose so then
Um
when you're pregnant, you're not just protecting your baby, you're kind of protecting and setting them up for life. So
yeah,
really will
which
step
is a huge opportunity.
exactly. Yeah.
And then, so let's say they kind of done those steps and they're kind of prioritizing their health. They're either maybe kind of adding in some more activity, or maybe they're kind of adjusting their activity down if they need to make sure that they are kind of having a healthy cycle and ovulating and all of that. And let's say we do get pregnant. And I guess, what are the biggest changes that you need to take into consideration with regards specifically to kind of, I guess, nutrition and lifestyle,
Sure.
and what would be those recommendations that you tend to give out to people on that?
So I'd kind of be hoping you're on your folic acid and then to continue that. And now actually, the new guidelines, we used to say continue for 12 weeks of your pregnancy, but now the Irish guidance is to actually continue that for the course of your pregnancy.
Okay.
Vitamin D is a massive one in Ireland. So actually it's basically we don't get enough sunlight. So the actual guidance is that everyone, not just pregnant women, should take vitamin D supplements from, I think it's October to March. In pregnancy, your vitamin D requirements go up. So it's recommended that all pregnant women take a vitamin D supplement. And it's particularly important for women who may be of an ethnic background, such as from Africa or Southeast Asia, we find that they particularly need vitamin D. So it's really important for them. You want to make sure that you're getting enough iron for two big reasons. Anemia is a big problem in pregnancy, and it's for two reasons. So one is the lovely baby is going to be taking some of your iron stores, and the second is your blood volume increases, so your iron levels get diluted, and a lot of women will end up anemic. And that itself, that lends to being tired and feeling dizzy and lightheaded. But also we know that when a woman is going to go into delivery, whether that be by cesarean section or a vaginal delivery, there is a risk of blood loss. So if you're going into that anemic and you lose blood, you're already at, you're a step behind. Whereas if you can go into your delivery with a nice iron level or hemoglobin level, you just set yourself up a bit better. One that I think we don't talk about a lot is iodine. So iodine is a mineral that is needed to make the thyroid hormone, but it's also needed for the baby to allow their brain to develop, to allow kind of like their neurodevelopmental process to occur. Now, if you're eating a balanced diet, you're probably getting your iodine unknowns to yourself, but particularly for women who are vegan or vegetarian, they mightn't be getting their requirements and may have to supplement. It's something I think we see in fish a lot. And that's something to think about. And then the other one is calcium. So your requirements again go up in pregnancy compared to a non-pregnant individual. Usually the rule of thumb is about 3 portions of a dairy of calcium a day. And again, for women who are vegan, that might be tough. You're going to have to be looking at fortified milks to see if what quantity of calcium is in them, and often you'll have to supplement your calcium. So they're kind of your 5 big ones, along with the folic acid, that you want to be looking at. And obviously that's on top of getting your macronutrients and your calories in general.
And I think I saw as well in the talk that you'd referenced the FIGO, the Federation, the International, I'm not gonna remember the full name, but their kind of food first approach, which I actually read that paper as well. It's very interesting. Obviously within it they're trying to cover like all the different kind of situations someone might be in, whether that's socioeconomic or kind of from, I guess, as you said, kind of vegan and stuff like that. But it is really interesting, specifically with things like protein needs go up and just general energy goes up. And I think you see a lot now where it's like, oh, the myth of eating for 2 isn't true. And I think what everyone's like, oh, I don't need to eat that much more. But you do actually, depending on where you are in different stages of your pregnancy, you do actually need to up the calories a little bit, because you are, as you said, there's so much changing. Like your blood volume changing, you're growing like, a placenta, you're growing a baby, you're growing all these things. Like everything is changing so much. You have to go and make milk production as well, which is a huge thing. And kind of goes back to what you were talking about with the iron, where again, people are starting to talk about this 4th trimester. So just after you give birth, and what you can do to kind of support yourself in this like huge phase of transition, really. And not only from like a mental kind of point of view and an emotional point of view, but a physical point of view as well, where, whether it's a C-section or whether it's a vaginal birth, it's going to be trauma on the body, and a form of whether it's kind of abdominal surgery or, you might get a tear as well. So I think the iron thing is huge and really important for people to know, if that's going to help them to perhaps heal or reduce the amount of blood that they have after that. So important. And even as well, then I said like milk productions and stuff like that, making sure you're actually eating enough to support that, because it takes a lot of calories.
If you just even think of it on a really basic level, your body is making a food substance. So amount of energy needed to support that process is massive. The energy needed to make milk is more than the energy needed to support pregnancy, which I always thought was mad.
I know. But not a lot of people know that, like it's not until you get to that point where you're like, oh right, actually I do need to kind of eat these different foods. And again, then it kind of goes back to that point, and I know I kind of talk about this a lot, but kind of goes back to that same, I guess, narrative for those who are trying to conceive and maybe underweight or kind of having a kind of missed periods and stuff like that. We tend to kind of be told this idea that eating a lot of food is something that's bad and to be avoided, but actually there's a lot of instances, if you are active, especially if you're growing a child or if you're breastfeeding, where you need those extra calories. They are going to be supporting a really important role with regards to looking after yourself, looking after your baby, feeding your baby, and all of that. So it really is just such an important message that can be challenging for people. Like, don't get me wrong, if you kind of are going from focusing maybe on a certain way of looking or a certain way of competing, and then having to adjust a lot of those elements of your life to kind of be more pregnancy specific, or I guess support pregnancy and put that kind of postpartum period. So yeah, it's really important. And like, what would you see most common, I guess, when you are dealing with women who are coming in, when it comes to, I guess, activity or lifestyle changes? Are there any kind of common themes that you see there, questions that people ask?
No, I think this is new. I think that it's kind of only starting that women are asking, what food should I be eating? Am I allowed exercise? Or I saw this prenatal Pilates class. Is it okay if I do that? So it's very new actually, and it's really great to see. But yeah, I suppose the two biggest ones actually are, what can't I eat?
Yeah.
I think women are more afraid of the things they can't eat rather than the things they can, which is really understandable, because I suppose you don't want to do anything that could potentially harm your pregnancy. And then the second, for women who are active, they I suppose are exploring their options of what they can do, what can they, if they're at a certain activity level, can they maintain that? And again, with exercise, it's the what shouldn't I do or what's not okay. So I think currently a lot of the questions are protective questions, if that makes sense, to try and avoid things. And less frequently, it's, what should I do or what should I eat? But we're seeing that a little bit more. I think maybe if there's more public education about, it's not just what you shouldn't do, it's all these other things you can be doing. I think if we got those messages across a little bit more, and I think we are, and I think we will, that conversation would happen a lot more.
Yeah, because I actually was on a panel there for Sport Ireland. I don't know when it was, because COVID's weird and I keep just losing track of time. But yeah, sometime last year, I think. But it was really interesting because it was actually on that whole topic of like, okay, well, what actually can you do? And I was on it as a kind of, I guess, talking about from a S&C, strength and conditioning, but more from what I guess you would call traditional gym based classes from that kind of point of view. And then there was a yoga instructor called Naomi who actually was pregnant at the time as well, and she was talking about yoga. And basically, the conversations that we were having was like, there's actually quite a lot that you can still do. Again, obviously with the caveat that as long as you don't have any contraindications, like there's I guess a list of absolute contraindications that you can't do. But if you have, I guess, kind of a risk-free pregnancy, there's a lot that you can still continue to do from an activity point of view, or even start to add in, if maybe you haven't been going to classes regularly or you don't actually exercise, but now, because again, it's starting to come in a lot more, that there are a lot of benefits when it comes to being active. Not necessarily, it doesn't have to be just exercise classes, just being active, getting up and walking around, or kind of, starting to kind of do some light stretches and just kind of build that up throughout the day. It really is just about just starting small and building that up. And I think, the recent WHO guidelines, the World Health Organization came out, and I thought that was fantastic because it did just highlight the benefits of it and remove, I guess, some of the element of fear around exercise, which was fantastic to see.
Yeah, no, it's great, because I think that's the thing, like in pregnancy, women are so understandably afraid to do anything that can harm pregnancy. And there was, I suppose, a bit of a thought, many years ago now, that, pregnancy or exercise was a further stress on the body, and, you need to rest. But now we know that when done correctly by the correct person in the correct way, exercise is so beneficial for the woman's physical health, for her pregnancy, for her mental health. And so when done correctly, it's actually a really great thing. Yeah,
and especially I think now during COVID as well, where if you are joining a class or something like that, it's just a way to connect with people, or like get out for that walk, or get outside, because it is so much harder to kind of build those social connections. And if you are, again, obviously both of us are kind of from the opinion that you should always go to a class or do something like that is under the guidance of someone who's trained in pre and postnatal exercise. But you get this opportunity to actually meet other people and talk about different things, and it's pregnancy specific, and you kind of get that, I guess, community sense as well, which is so important. as well from like a mental health and I guess an overall support network and support system point of view, which is huge at any time of your life, but specifically during pregnancy and that kind of postnatal period as well. Um, and then I guess like I know you're saying not to focus on what you can't eat, but what are the kind of main things that you should, I guess, avoid or try and limit? And I know when I was writing this up for a blog post, I was like, it's basically all the things I love.
So,
But do share because
so
it's good for people to know.
we'll say one of the first biggest ones is, the guidelines go back and forth on this. Alcohol. So we think that probably one glass of wine is fine, but as just a blanket rule, I think when I'm advising women, my blanket rule for safety is, if you can, cut out alcohol totally. Obviously if someone gets a job promotion and you've a glass of wine, that's fine, but I think a blanket rule, no alcohol if you can. This one I think is tougher for women. So smoking, I know it's not food, but I suppose we'll always include it under lifestyle.
Absolutely.
Obviously the best thing is to not smoke in your pregnancy, but I think that's very easy for me, a non-smoker, to say, just stop smoking. I understand it's an addiction and a very strong one at that. So if you can cut down even, that is amazing and will really benefit your pregnancy. Then in more specifically in terms of food, there's a kind of few random specific things. So to avoid pate, and the reason for that is it has really
I'm crying.
really high levels of vitamin A, which can be toxic in pregnancy. And then so the other things that you might find a lot of vitamin A in, so again, liver, if anyone eats that. There's certain, you want to limit your seafood intake a bit. So I think it's like swordfish and shark you shouldn't be eating.
Yeah, and marlin. I was like, I don't think I've ever seen marlin on it.
If you're eating things like sardines out of a tin, you might want to limit that to maybe one portion a week, which I think is very doable. Then it's the rest of the things are caution. So caution with things like soft cheeses, caution with undercooked meats. So if you're cooking at home, which obviously I suppose everyone kind of is doing at the moment, to really make sure that they're cooked well. If possible, you don't want to get food poisoning in pregnancy. I don't even know if it's available in Ireland, but you want to avoid unpasteurized milk, cheese, yogurt.
Yeah.
I think
it's starting to become more now with like the food markets and stuff like that. But I think in the supermarket, not really.
Exactly,
I don't think I've ever seen unpasteurized.
Unpasteurized.
So
they're kind of your big ones. I'm sure I'm missing one or two, but they're kind of the big ones.
Yeah.
They're quite specific. So often, women will say, "Oh well, I don't eat or do those things anyway." So, but they're just things.
Unless you're like me, who eats liver and tin sardines quite regularly.
Yeah, it's just.
But yeah, most people don't.
Are cooked well. Your eggs are cooked well. Sometimes try and avoid, the soft cheeses. Caution at delis. You can eat deli meat, but caution at them.
Yeah.
Just anywhere you think you could get an infection that, we would probably, be sick for 24 hours. A pregnant woman can be a lot sicker, so just caution with them.
Yeah.
They're kind of the big ones.
Yeah, I remember actually when I was a teenager, I went on Roactane, which is obviously high levels of vitamin A or vitamin A derivative, same sort of thing. So I used to have to go in. I have a twin brother, and he was on it as well, and he had no issues. And I had to go in for like the monthly blood test to like make sure I wasn't pregnant, all this kind of stuff. And it was quite a, I'm not gonna say stress, but it was definitely something that they were taking very seriously because obviously it can have such an impact. But he was told, and this is another kind of interesting note too, he drank a lot of super milk. The way it's fortified, like a lot. I think at the time he was like, I don't know if he was rowing at that stage, but he was doing a lot of kind of exercise. He was eating a lot of kind of like porridge and cereals and stuff like that. And when the doctor heard how much it was, he was like, yeah, okay, you should probably just change to regular milk because it would actually be quite a high concentration of the vitamin A. So not that I think people are going to be drinking the same amount of super milk that my brother was at that time, but it's good to be aware of.
Yeah, it's just something to be aware of, exactly.
Exactly. And what about coffee? This is the one that...
Yes, sorry, I forgot about this one.
Or caffeine, I should say caffeine, because it's actually more than just coffee.
I always say coffee, and then I realize, no, wait a minute, it's caffeine we're speaking about. So the recommendation in pregnancy is 200 milligrams, and I know, what does that mean? 200 milligrams is probably 1 cup of coffee. Certainly, it's a cup of coffee from store, not homemade coffee, if that makes sense. But the thing to keep in mind is that caffeine is in other sources. So caffeine is in tea, caffeine is in green tea, and caffeine is in chocolate.
I know.
So, and then things like Coke, Diet Coke, etc. So
Yeah.
if you're drinking, one strong cup of coffee, you should have a look at, your other sources of caffeine. Like, are you sitting down and having a full bar of chocolate? Are you having 2 cups of tea in the evening as well? And just kind of evaluate your caffeine intake, which is an unfortunate one.
I know. And it is all things. I remember you mentioned it before with the trying to slowly introduce these changes. If you are consciously trying to conceive, to try and start introducing these changes, I guess pre-pregnancy while you are trying to conceive as well, to kind of make that transition a little bit easier. So trying to swap it out. And actually, in fairness, there's if you like the kind of more like micro, I guess, coffees and stuff like that, there's actually some really nice decaf variants that are out there, because back in the day you'd have that kind of like freeze dried decaf instance. Some people like it, but it's not for everyone. But there are some nice alternates out there, and the same with the beers and the wines and gins. Like there's some fantastic non-alcoholic options or low.
So they're actually quite available. It's great.
Yeah, it's brilliant. It's so good. For anyone who likes gins, there's this really nice one called Seedlip that is like a fake gin, and it's actually like you wouldn't know any different, and you can surreptitiously ask for it in the bar as well. Well, whenever we go back to being in a bar, to kind of ask for that instead of a gin as well. Yeah, I've done it a few times, and I'm trying to keep it low alcohol when I go to work the next day.
It's handy for people, I think, because some people, I think, they enjoy the idea of a drink, or they enjoy the taste. It's not necessarily the effect of the alcohol. So
exactly,
if that's you, these sort of things are a great option.
Yeah, and you can just start trying to, I guess. Yeah, I find it great. Like, because again, you do just sometimes want that drink. This is obviously going off pre and postnatal topic, but sometimes you do just want to have that taste, and but you don't actually want to drink or kind of have a hangover. So it's a great option as well. And actually, again, different plug, but when we all opened back up, there was a great bar, if anyone's in Dublin, Capel Street, I think, called the Virgin Mary, and they only serve low alcohol or non-alcohol things, which I thought was great. So you can go and have it was great. So you can go and have like a bar experience, but without having to actually order alcohol. And they're very good. They do like cocktails, wines, beers. It's nice. So shout out to the Virgin, to the Virgin Mary. I know, I'll tag them in the bottom after this, so just if anyone is interested. But for anyone who's in Dublin, I'm sure there's more around kind of Ireland and in England and stuff like that. But it is useful. We did get a question in that was quite specific, that didn't kind of fall under the category of, well, it kind of falls under the category of what we're talking about, but one person did ask, it was like, if they can't get their bloods tested now, is like just taking the folic acid and vitamin D enough, or should they be kind of taking that, I guess, the like trying to conceive or the pregnancy multivit?
Realistically, taking the folic acid and vitamin D is probably enough, especially in the first trimester. It's not until trimester 2 we start seeing iron changing. Now, some women just like to get straight on it. If you are eating a well-rounded diet, that should be enough. If you think and I'm not targeting vegans, but just definitely they have to think about it a little bit more.
Yeah, of course.
Or if you have certain restrictions within your diet, or you've concerns that maybe you're not eating enough in general, so you might be getting enough nutrition, certainly then pregnant care is something to look at. But I think for the average woman who eats well and eats a well-rounded diet, folic acid, vitamin D, certainly for trimester 1 should be enough. Perfect.
And then as well, I know you've been posting about this a lot, so I did kind of want to ask you on this about the COVID vaccines and kind of I know there's like more and more kind of guidelines or information coming out about it a lot more recently, which is fantastic, but I'm sure people have kind of questions about that, both from a trying to conceive point of view or from a I'm currently pregnant, what should I do? So what again, at the minute, what are the kind of guidelines?
Sure, so we'll go with trying to conceive first, because it's a bit more straightforward. Trying to conceive, it is absolutely fine. There's no concerns about fertility. I suppose when I say we, I mean we as all of the obstetricians and gynecologists. We're not sure where that even stemmed from. There's not a concern about that. There's not a theory. There's not a mechanism that you could even say, well, I suppose this could happen. It's not a concern. And I suppose I say this as a woman who has not yet conceived and hopes to in the future. I got it with with no fear of that. And I suppose sometimes that's the best way to advocate for something, to say, I would do it myself.
Yeah.
And I would recommend it to my sister and my friends. And I think that's the best way to reassure people. In
Yeah.
terms of the delay or the interval period between getting it and trying to conceive or undergoing fertility treatment, I suppose there was some guidance from the British Council, so the RCOG, about a delay or an interval period. That was out of extreme caution, and we now know that it is safe to conceive almost immediately after the vaccine,
Okay.
or proceed with fertility treatments. The one caveat is a lot of people are finding that they're a little bit unwell after vaccine too, so just something to keep in mind. You might push it out a week just so that you feel well. So that's a really easy one. It is safe if trying to conceive.
Great to know.
Pregnancy is a little bit more nuanced. And I think people really struggle when a doctor or a medical professional or a scientist can't give you a black and white answer. And we can't. And it's likely that it will be many years before we can say anything with certainty. So what we know at the moment is that we don't know of any negative effects of the vaccine on a pregnancy. We think it is probably safe, but we cannot say with 100% certainty that it is, but we think it is. We know that COVID can be very dangerous, and we do know that women who end up in ICU who are pregnant can get quite sick. So what I suppose you're trying to do is balance risk. We think that the risk of the vaccine is very low. We think the risk of COVID in pregnancy is low, but there is risk there, if that makes sense. You're balancing a bit of risk against probably no risk. So then you start looking at, well, then who would really benefit from it? And there's two main groups who would really benefit. So the first is someone who's going to be more likely to be exposed to COVID, and that's healthcare professionals. And whether that's doctor, occupational therapist, physiotherapist, nurse, midwife, more that I'm not including, but anyone who works in that.
Yeah.
So they're more likely to be exposed, more likely to get COVID. And then I suppose in theory, if you're more likely to be exposed, you're more likely to get sick from it just from exposure. The second is women who would be more likely to get sick from COVID. And these are women who have underlying medical conditions. And that can be anything from, a respiratory condition, so asthma, if a woman has diabetes. So these are all, or, a woman who's immunosuppressed, so she might have a condition, or she might be on chemotherapy for cancer. There's a whole host of conditions. So for these women, we know that COVID probably poses some amount of risk to them. So for them, we think that the benefit of getting the vaccine outweighs any potential risk of it. So those two groups are a little bit easier. Obviously, it's the woman's decision. The in-between ones, so we'll say a woman who's working from home, who's no medical conditions, and she's 30 weeks pregnant, what should she do? And we can't answer that for her. What we can tell her is that there's probably no risk, but she probably, if follows the guidelines, isn't going to get COVID. So that's a decision only she can make. So there's no, there's not actually, this is exactly who should get it and this is who should not get it. It's a tough one.
Yeah. So I guess if you're not falling in those two groups, it's more about trying to figure out where you're falling and what kind of risk you're comfortable with, and looking at kind of your overall lifestyle, as you said, like, are you exposed? Are you not? Like, are you kind of at risk of getting it, et cetera, et cetera.
Exactly.
And just trying to, I guess, stay on top of any of the new guidelines that are coming out, and just making sure that you're kind of informed, that you're talking to your consultant about that as well.
Thing, because you need to take such an individualized approach. What women need to do really is either meet with their GP, midwife, or doctor who knows them and knows their medical history, and have a chat about what's best for them. I suppose that's your blanket advice, is to talk to your healthcare professional and make a decision about what's best for you.
Yeah.
There's two, I just left out two little small bits, sorry. What we're saying is just with pregnant women, we're trying to avoid it before 14 weeks of pregnancy and after 33. The reason for that is a little bit in the air. It's that I suppose a woman can miscarry before 14 weeks for no reason, or for many reasons, and we don't want the vaccine to be linked to miscarriage. We would never be able to prove if it was or was not related. So it's to remove that. And after 33 weeks, we're trying to avoid having the vaccine linked to inducing preterm labour. and it would be very difficult to prove, was it from the vaccine or was it something else?
Yeah, because I think well, sorry, it wasn't with the vaccine, but it was more to do with if there was like some numbers coming out in, I think it was China, where it was kind of potentially COVID was linked to preterm, but then they were like, we actually don't know
Yeah,
because we couldn't rule out other factors and all that kind of
yeah.
stuff. So
It's just true.
yeah, that makes sense with regards to that. Yeah, exactly. And actually, I don't know if you've ever read this, kind of slightly going off topic, but I was just thinking about I guess the trying to conceive, and also then I guess the egg quality as well when it comes to that, not only with regards to trying to conceive, but the miscarriage as well. As I started reading the book by, I think it's Fesh, is it Rachel Fesh is her name? It begins with the egg. I can't comment on it because I haven't actually read it all, but it's quite an interesting. Her approach is looking at the research and looking at what I guess you can do from like a lifestyle point of view and nutrition point of view to try and improve egg quality, because it's the egg quality that is, I guess, the best predictor of like successful IVF implantation, I guess just in natural implantation if you're not kind of going down through IVF as well. So yeah, I was just wondering if you had read that at
I
all, or if you'd
haven't
heard about it.
put it on my list. Sounds like an interesting.
Yeah, it looks great, and I kind of just started looking at it, but she's updated it. She released it. She's got, I think it's the second edition now with kind of more up to date
Yeah.
research papers on it. But when I do finally finish it, I'll put a
Yeah.
post up on it. We're kind of
Yeah.
yeah, no, it's really good. That was just kind of, I guess, a recommendation to anyone who is listening with regards to the who trying to conceive and all that kind of stuff, because it's all linked, and it's not. We tend to kind of bucket people into, okay, trying to conceive, pregnant, postpartum, but it's actually all one journey in inverted commas, but it all kind of feeds into each other, and everything is linked. And I guess what we were talking about earlier with regards to what you do during all these stages can have such an impact not only on your health but the health of kind of the baby as well, which is fascinating, and I guess isn't there to scare anyone. It's more there to be like that you actually have a huge opportunity to kind of support yourself and support your baby as best you can. And then as well kind of goes to the exercise point of view. And I know we kind of talked on it a little bit as well, but doing things like strengthening up your shoulders, strengthening up your glutes, kind of making sure that you are, I guess, cardiovascularly fit. And that doesn't mean you have to be able to run marathons and stuff, but it's been kind of linked to kind of reduce labor time and kind of recovery as well. And as well, pelvic floor health. It's all, I know myself and Aoife in the gym when we're doing our training, we always kind of recommend that someone goes to speak to a pelvic floor physiotherapist. So again, you're kind of getting that, I guess, multidisciplinary team, which I know is thrown around a lot, but you are kind of covering off the different boxes where you've got your consultant, or you've got your GP, you've got your trainer who's qualified, you're kind of getting information about nutrition as well, and then you're talking to someone who's a specialist in women's health and pelvic floor health in particular, who can kind of help guide you on whether you need to learn to strengthen or relax. And then there's so many great options as well when it comes to labor prep. And I know there's some like great books out there about kind of like hypnobirthing and like positive birth company. I think are supposed to be very good as well. The content that they put out is excellent, but I haven't actually read their book yet. But so there's lots of things that you can do, I guess, to support yourself, or lots of different people that you can reach out to kind of support yourself. But I know you spoke about it in your talk, but for you, what's the things that you would recommend people to do with regards to exercise from, I guess, like a strengthening point of view, or the reasons that you would kind of encourage people to stay active?
Sure. So I suppose, like in pregnancy, we'll maybe break it down to like 3 reasons. So just even first, mental health. So pregnancy is a really stressful time emotionally, and even more so now in during the pandemic when we're all isolated. So as you were saying, if exercise offers you either a release of endorphins, or gets you out into the daylight, or gets you involved with a community, then that's really, really beneficial. I suppose the second is, from a strength and conditioning point of view, and kind of I always think of 2 big ones, I suppose. When you're pregnant, you're carrying around a mass, for want of a nicer word for a lovely baby, but you are carrying around a mass at the front of your abdomen. You're carrying it around all day, every day, and it's lopsided. You're holding it at the front. That's a lot of pressure on your abdominal muscles, a lot of pressure on your posterior chain, so primarily your back. And to have a nice strong foundation to support that will really benefit you. And then your pelvic floor. So regardless of what type of delivery you have, we know that supporting your pregnancy in general puts pressure on your pelvic floor. So even a woman who has a cesarean section, she will have some degree, I suppose, of, her pelvic floor will have worked to some degree, and it's nice to have a strong pelvic floor. For women who have a vaginal delivery, and that can vary, so it can be a straightforward vaginal delivery, or it can be an assisted vaginal delivery, and that's where baby is delivered using a suction cup or forceps. You then also have a spectrum of tears and cuts. So a woman can tear her pelvic floor. Sometimes she can tear actually into the muscles of the back passage. She could have a thing called an episiotomy, which, to put in the most simplest terms, is a cut. And these things all damage the pelvic floor. So, a vaginal delivery will damage the pelvic floor to some degree, and it varies. So for women to go into delivery with a strong pelvic floor will stand to them, but also for a woman to engage in pelvic floor exercise postnatally will really stand to them in later life. But that's a really big reason. And the third is things we're seeing emerge a little bit more. So women who exercise are less likely to get gestational diabetes. They're less likely to get high blood pressure or preeclampsia. And we know that health or exercise helps to maintain a healthy weight, which will benefit and aid in kind of supporting a healthy pregnancy. So I just think there's so many reasons to engage in exercise during pregnancy. I think it's a really great idea.
Yeah, no, it is. It's fantastic. And as well, it's important to say that, I know we mentioned it before, but it's also just including all activities. So when we're talking about exercise, obviously I think it's recommended now, the World Health Organization, we're talking about like 2 strength, or was it, what paper was it? I can't remember, but there was a recommendation of 2 maybe strength exercise classes. So whether that's Pilates, whether it's more kind of the classes that I do, where you're looking to kind of strengthen your muscles, kind of improve your, I guess, muscular endurance and your fitness levels, but it also includes just going for walks, and includes starting to kind of, do more housework. Whether you like yoga or Pilates, that all falls within that recommendation as well. And even the new ones are kind of suggesting, and this isn't me in no way telling everyone to go out and start doing vigorous intensity, but if you are someone who has trained at that level and has continued to train at that level, who becomes pregnant, there's kind of evidence to support that that's not going to have an adverse effect, and that, as long as you're kind of listening to your body, not pushing to maybe the 9 out of 10 that you might be used to, but you're maybe going to that kind of like 8 out of 10 or 7 out of 10, like there's no adverse reactions if you are used to training at that level. And I do believe that hailstones have just started outside my window, so if you can hear that, it's very loud, so I apologize if you do. But I think as well the pelvic floor thing is so important, and it's more and more people are talking about this mummy MOT, and it seems to be way more common, I guess, in like England, in Europe, and maybe in America as well. But it's something that's starting to change in Ireland. I know there's like really great physios out there, like Helen Keeble, Elaine Barry, who are all kind of doing work in this area. And like, that's just to name a few. There's like loads of them in Ireland. But like Absolute Physio is another one. I've blanked on her name, but it's really important that you go and get checked afterwards. Obviously, you're going to go for your 6-week check, but to make sure that you go for that internal check and check your diastasis recti as well, to kind of just get a view overall of what you need to do postnatally to kind of heal that pelvic floor is really important. And then going to work with someone who's, again, trained to help reintroduce you to exercise, whether that's running, whether that's you wanting to go back to yoga classes, or your, I guess, more traditional gym classes as well. It's just important that you kind of get that seen to, just to make sure that you're doing what you need to do to support your body healing.
And so like, I suppose our specialty is so interesting, because I know we talked all about pregnancy, but the other side of my specialty is gynecology, which is women's reproductive tract. So we see women who are in their 50s and 60s, and they're coming to us with prolapse that completely interferes with their quality of life, or urinary incontinence. And there's, they'll say to me, I can't go to the shop because I know I'm going to wet myself. Like, that's a totally upset quality of life. And often the only risk factors we'll identify for their prolapse and urinary incontinence is, I had three 10-pound babies. And I think, for certainly, I'd say our grandmothers, and I'm going to say maybe my mother, I don't know if pelvic floor was ever mentioned to them. It's not something that was looked at.
I don't think so.
I've seen it now for them. So it's I love seeing all of the and I think Instagram's amazing for it, but so many women talking about pelvic floor, talking really comfortably about women's vaginas and vulvas and pelvic floor, and I'm
Yeah.
brilliant.
Yeah, no, it is. And it is something that I think people just kind of, there's an element of like privacy or shame about it. We're like, oh, I have this thing, and you can live with it for your whole life, and it does affect your quality of life. But like, not only if you just had kids, like even for myself, and I know kind of some people have heard me talk about it before, but like I had stress incontinence. So like when I would say do plate hops or jumping jacks for too long, and that was for me. Obviously, it's different for different people, but I was hypertonic, so I was overactive. I couldn't learn to relax my pelvic floor, which like any muscle is really important to do so. So you need to be able to contract it as well as relax it for it to be able to work properly. And I haven't had kids. Like that's just something that
Yeah.
I developed through whether it was breathing mechanisms or whatever it might be, kind of stress, etc., like that. So I had to go to a pelvic floor physiotherapist to help me work through that. And it's obviously hugely important because exercising is a massive part of what I do, not only
Yeah.
for enjoyment, but also as a coach as well. So, if there's anyone here who maybe hasn't necessarily had a kid or kind of gone through that experience, but is suffering with pelvic floor health, like please go. There's loads of really great physios in Ireland who kind of specialize in this. So if you're looking for it, you're looking for like pelvic floor physiotherapist, or sometimes they're referred to as women's health physiotherapists, or going and seeing a gynecologist as well. All of these can kind of help you, I guess, address what is the underlying cause for you for that kind of I guess pelvic floor dysfunction, or whether it's stress incontinence or urinary incontinence. But yeah, no, it is something that can be resolved through support and through pelvic floor physiotherapy. So it's really important that we kind of normalize that
Yeah.
as just part of women's health in
Yeah.
general, and specifically part of that recovery process after pregnancy as well.
You want to toe the line. See, I find sometimes what women's problems is, what you want to do is talk about them so much and make them normal and comfortable so that talk about them and get the help, but also acknowledge that stress incontinence is not normal. There's nothing to be embarrassed about, but it's not normal. It's something that needs to be looked at. So I always find that line hard to, tie.
Yeah.
I'm trying to say, you shouldn't be embarrassed about your problem, but it's not normal and you need to get the support and help for it.
Yeah, exactly. I actually think there's a great line, because I've heard it referenced with regards to period loss, where they say it's common but not normal. And I was like, that's perfect, because it is common and it's something that a lot of people deal with, but it's not normal. Exactly. Yeah.
You've nothing to be embarrassed about. There should be no stigma attached, but you also should not put up with it.
Yeah, exactly. You deserve to go get that sorted, supported, whatever that might be. And so that I think is a great way, because it is a kind of fine line, I guess, that you're kind of like, don't accept it, but don't worry about kind of being different, or kind of, that it's something to be ashamed of. So yeah, no, I totally
don't know, maybe someone will disagree with this, but I think some of the, the always ads for urinary incontinence.
Yeah.
And I think they're doing great. They're talking about it on public TV, but I sometimes think that they're trying to say, this is normal,
Yeah, I agree. Craig, whenever those ads come on TV, I'm like I think I'm like, it's good, and he's like, I know they should be coming to a pelvic floor physiotherapist and getting looked at. I'm like, but they should, you know what I mean? I'm like, regardless of what age you are, like you don't have to put up with it,
A pair of knickers and you're all fixed.
Yeah, exactly. And I think there was even a joke. I was trying to find it one time for an article, but where it was like one of the CrossFit things. I don't do CrossFit, so I can't comment on it, but I can't remember what like one it was, but it was one of the opens, and you have to do like a load of double unders, and everyone was like, oh, and it was this kind of running joke that you'd need your like panty liner for that workout, because there were so many double unders. And I think that's what caused, or was one of the things that I think people did something on a story called, was it dry unders? And it was kind of play on words, and it was basically talking about kind of that stress incontinence and how it is so common in women, but we don't really talk about it. But it is something that you kind of address through, whether it's breathing mechanics, learning to kind of engage your pelvic floor, relax your pelvic floor again, kind of whatever the root cause is for you. But I just remember that was kind of like a running meme at the time, which it probably shouldn't be. But yeah, but look, like, fantastic talk, a wealth of knowledge as always. So I guess I'll leave a comment with your kind of tag for if anyone who does want to kind of find out more or get in contact and everything. And, I'll be doing a couple of posts over the next couple of weeks about topics that we've discussed. Obviously, a lot more of my pre and postnatal stuff tends to exist on my other Instagram account, which is the Sinead Brophy one, but it's definitely something that is very much my other love and is something that I'm going to be incorporating more into to go with the flow because I guess it's just an important topic with regards to women's health.
The journey of it all, it's all linked.
Absolutely. It's all like one big circle and so interlinked. Yeah, exactly. But thank you so much for coming on. Yes, and have a lovely Friday evening. Hopefully that hailstone stopped. Sorry if anyone could hear it.
Bye.
But look, thanks so much. See you later.
Bye.
Bye bye.